Hi everyone, Angelfaceamy here, your ostomy nurse. If you're new to having an ostomy, this video is especially for you. Leaving the hospital with a fresh ostomy can feel scary, but I'm here to share the 5 most important things I always tell my patients before they go home. Things that will help you feel more confident and safe as you're going home with this new ostomy. First, how and when to empty your pouch. I recommend emptying your pouch when it's about 1/3 to half full. If you wait too long, you risk leaks. Find a comfortable position sitting on the toilet or standing over it. Both of these ways work well. If you do stand over it, I've heard that putting a few layers of toilet paper on top of the water helps prevent splashing. You're going to want to gently tip the pouch opening and empty the contents slowly to avoid splashing. Always wash your hands before and after. So it's really that easy. You're just going to want to make sure you do this yourself in the hospital before you leave, because once you do it, you'll see how easy it is. It's hardly different from going to the bathroom. You just need to go in there, empty the contents into the toilet, and then you're going to want to wipe off the very bottom, the tail, and then roll it back up and close it, and you're good to go until it needs to be emptied again. So next we're talking about changing your pouch. I recommend you change your pouch every 3 to 7 days. This is typical, but you're going to want to listen to your skin, because everybody is different and everybody's skin has a different amount of moisture and oiliness. So you're going to want to watch in the beginning to see if you see leaks, skin irritation, or the pouch loosens early, and then you're going to want to change it more often than you were doing it. So you could try to change your appliance every 3 to 4 days to start and see how that goes. And then you're going to want to have a clean, dry skin surface before you put the new appliance on. And I always recommend you have like a routine. You start and stop everything the same way. You have all the same supplies and you do it the same every time in the beginning. So that way you just have no surprises and have everything you need. So this helps. The routine helps. And some people pick the same day each week. A lot of times I recommend that patients change it in the morning before they start eating and drinking, because that's usually a little bit easier to change it then. There's less output. It's important to know when to contact your nurse or doctor. You're going to want to call the nurse if you see redness or swelling spreading beyond your skin around your stoma, persistent bleeding, a stoma that looks very pale, dark, or changes sizes suddenly, severe pain that doesn't improve, a fever, or signs of infection. You're going to want to not hesitate, because early help means fewer complications. So if you notice any of those things, you're going to want to call the doctor right away. Comfort is key. Choose soft, breathable clothes that don't press on your stoma. High-waisted or elastic waistbands often work well. Support belts can help once your incisions have healed. They kind of help just to hold everything in place and give you a little bit more security, and also a little more, it just kind of holds everything in and muffles the sound and everything too. So lastly, remember, this is a learning curve. Feeling overwhelmed or frustrated is normal. Most patients find that with time and practice, ostomy care becomes second nature. Be kind to yourself and reach out when you need help, because this is hard and it takes time to get used to, and there's so many tricks you can learn. Thanks so much for watching. If you're new to ostomy life, I hope these tips make your journey a little smoother. Please like, subscribe, and share your questions or your stories in the comments. I'm here for you.